Hey there, welcome back to Dietitians and Nutrition Support. Per your request, today's video is about peripheral parenteral nutrition, otherwise known as PPN. So this video talks through some of the basics of PPN, some of the pros and cons, as well as a little bit more information about osmolarity, how to calculate it, and why it might be important for your patient. So let's go ahead and get started. So what is PPN, or peripheral parenteral nutrition? When we're talking about parenteral nutrition, we're talking about IV nutrition support. And when we're saying peripheral, we're really just saying that we're going to use a peripheral site to infuse this from, typically somewhere on the arms or the hands. PPN is particularly interesting because it happens to be administered in a very large volume of a dilute solution, based particularly on the osmolarity, but we'll get a little more into the calculations for osmolarity in just a few minutes. The cephalic, the brachial, and the basilic veins are all commonly used for peripheral parenteral nutrition. It's important to note that PPN is somewhat uncommon and not used nearly as much as central parenteral nutrition is. This is because it's often used as supplemental nutrition support, being that it's very difficult to get as much energy and protein as you might need from peripheral parenteral nutrition as it is to get it from central parenteral nutrition. And again, this is mostly related to osmolarity that we're going to speak to in just a few minutes. PPN is particularly good for people who have a lack of central access, meaning that they don't quite have the ability to have a long-term central access point placed, which leads them to using a peripheral site instead. And there's a variety of reasons for that. But because it's peripheral, this also means that we're going to only have a shorter term of access. Peripheral lines can be used for days to a week or two based on site integrity before switching peripheral sites or considering placement of a central line if appropriate. So let's consider again how we have a very dilute solution with our peripheral parenteral nutrition. So this is going to indicate to us that we have a lower concentration of both calories in general as well as our individual solutes. So all the amino acids, dextrose, lipids, all those things. They're going to be at a much lower concentration to try and maintain a lower dilute solution. And we'll still get to osmolarity in just a minute, but note the fact that this is going to make it a lot harder and it's going to require a lot higher volume to be able to get the full calorie and protein needs for each of your patients. So this is why, again, if you're able to give a central line, it may be more appropriate for your patient to actually achieve their full needs as opposed to peripheral parenteral nutrition. So let's consider some of the pros of PPN. For PPN, there is a little bit lower cost and a touch bit lower maintenance overall when you compare a peripheral site to a central site, so that can definitely be a benefit for your patient. As you can imagine, having a peripheral site as opposed to a central site is definitely easier to access, just because you can have it on an arm or a hand, something like that, and it's a little bit easier to get to than if it's underneath of a hospital gown or underneath an article of clothing, so generally easier to access when it comes to PPN. PPN is really good for people who are going to be on parenteral nutrition for an unknown duration of time. So if you're not really sure if they're going to be on it a long time and whether or not you're going to need to actually get a central line placed, or if they're just going to be on it for a few days, it can kind of help you to get somewhat of a bridging into parenteral nutrition without having to have the full central line placed. And finally, with a peripheral line, you have a lower risk overall of infection at the site as compared to a central place line. Looking at the volume piece of this and considering a patient who might be fluid restricted, it's not really super appropriate to use PPN for a fluid restricted patient, especially when you're trying to meet all of their goals through parenteral nutrition, because like we talked about, it's a very high volume and dilute solution. You're going to end up essentially with a case that you're not able to get the kcal or protein needs of your patient just because you cannot provide enough volume of the dilute solution to reach it. So central nutrition or parenteral nutrition would probably be more appropriate. As we've already kind of mentioned, short-term use is primarily the best application for peripheral parenteral nutrition. So that again puts it into the con category as well of if you need long-term parenteral support, it's not really appropriate to choose PPN for that. And while it's particularly true with a fluid-restricted patient, this is true across the board for all patients because of the high volume and very dilute solution of peripheral parenteral nutrition. It is particularly difficult to meet full needs from PPN, making it very much more useful for supplementary and certainly short-term usage as opposed to full nutrition support. So I keep mentioning osmolarity in this video, but the real question is, what even is osmolarity? So osmolarity itself is talking about the amount of solutes that are in a particular amount of liquid. So we're talking about how many solutes or how much stuff is in our parenteral nutrition solution itself. So considering the osmolarity of a human, typically, that normally estimates out to approximately 300 or so milliosmoles per liter. And that's just a measure again of kind of how much stuff is in a liter of the solution or the liquid.
For the osmolarity of PPN solutions, we can go a little bit higher than the typical human osmolarity, hitting about 900 milliosmoles per liter. You'll see that there's some differences in recommendations that maybe go up somewhere to 1100 milliosmoles per liter, but for the most part, the kind of standard cap is about 900. When you're comparing PPN to a central line parenteral solution, the peripheral parenteral nutrition has to be kept at a much lower osmolarity than you can provide centrally. And for the most part, this is to preserve vein integrity. So it's certainly easy to run the risk of going too high with the overall osmolarity of your PPN solution, putting someone at risk for increased inflammation of the vein, which can certainly be painful and dangerous. Increased thrombosis can happen in individuals who have too high of an osmolarity of PPN provided, some chance for swollen limbs to take place, and then overall just seeing general vein damage. So really it's pretty detrimental to provide too high of an osmolarity of PPN. So certainly important to know what the osmolarity of your PPN is and kind of how to roughly calculate that for yourself to make sure you can protect your patients from having too high of an osmolarity. So then let's consider what's even adding to the osmolarity of this solution. What's going to help us reach this 900 milliosmoles per liter or less? So the first macronutrient we probably are thinking about is going to be dextrose. You'll see most often with PPN formulas that they like to use a 10% solution oftentimes. So remember that's 100 grams of dextrose per liter. Amino acids are the next macronutrient we're thinking about, typically seen in a 2 to 2.5% concentration within our PPN solutions. Remember that's 20 to 25 grams per liter. And finally, we will start to see the addition of lipids within the PPN. It's very variable as to what concentration folks will use for lipids, but 10, 20, and 30% are all regularly used or some variation within there. It is notable that dextrose and amino acids typically provide the significant portion of the osmolarity. Lipids will provide some, but it's certainly not as significant of an amount as you'll see from the other two macros. All right, so then how do we even calculate what the osmolarity of our solution is going to be? We can do this by calculating each of our components separately. So first let's look at the grams of dextrose. We can multiply grams of dextrose in a liter of the solution by a standard value of 5, and the outcome from that will give an estimation of the osmolarity of our dextrose portion. Amino acids are pretty similar. We can take grams of amino acids, multiply by a standard value of 10, and this will give us an estimate of the total osmolarity for the amino acids portion of our solution. And finally, looking at lipids, we can take grams of lipids per 1 liter of the solution, that's standard across all these, multiply by 1.5 and get the osmolarity of the lipid portion of the solution. Obviously, macronutrients are not all we're going to put into this solution, so we'll also need to look at some of the other electrolytes and things that we'll be putting in. So we can help to kind of calculate various things that we'll be putting into our solution by looking at the cations in the solution. We can sum up their values in milliequivalents per liter, multiply that by 2, and then that'll give us a rough estimate of the osmolarity that's provided from the vitamins, minerals, electrolytes, and all those pieces. Should you not have the sum of the cations information available, you can kind of estimate those values at about 300 to 400 milliosmoles per liter that are going to be provided as kind of a substitute of this whole math portion of the solution. So you can estimate the osmolarity coming from vitamins, minerals, electrolytes at about 300 to 400. So to give you a feel of what all of this math might look like, I'm going to go ahead and clear part of the screen here for us, and then we'll start laying out an example. So you'll see on the right-hand side of the screen, we now have information for a solution, and particularly information for 1 liter of that solution, which is the values that we're going to pull to put into our osmolarity calculation, only for 1 liter, remember. So we have information for all of our macronutrients as well as the electrolytes that we're going to use to estimate osmolarity. Starting off first here with dextrose, we have 100 grams of dextrose in the solution. If we multiply that by our standard value of 5, that gives us 500 milliosmoles per liter of dextrose. And recalling again that milliosmoles per liter is really just talking about the amount of stuff that we're putting into 1 liter of our solution. Moving next to amino acids, our solution has 20 grams of amino acids per liter. Multiply that by a standard of 10, and this gives us a value of 200 milliosmoles per liter. And our last macro here is lipid. 30 grams of lipid per liter multiplied by the standard of 1.5 is going to give us 45 milliosmoles per liter. That's coming particularly from the lipids. Now using our electrolyte information here to estimate how much osmolarity is going to come from that, we can start adding up the milliequivalents here, seeing 25 plus 5 plus 15 plus 15 is going to give us a total value of milliequivalents per liter of our electrolytes. We can multiply that by 2, and this is going to give us a total outcome of 140 milliosmoles per liter. Recall that, like was mentioned earlier, the 300 to 400 milliosmoles per liter can be used as kind of a rough estimate of all of the micro and small stuffs that we might have within our solution. But as you can see, the difference was pretty fair here. 300 to 400 is certainly much larger than 140. So just know that if you can do the calculations, they'll be a little more precise than the estimate, but the estimate is still helpful, better than nothing certainly. So then it's now time for us to start adding all of these values together to get the total osmolarity estimate for our solution. We can take our 500 plus 200 plus 45 and plus 140, and that's going to give us a total osmolarity estimate of 895 milliosmoles per liter. We've also mentioned that 900 milliosmoles per liter is kind of our hard cap point. So you can see that the 895 is just below that, and so should, in theory, be safe to infuse peripherally for a patient. So I hope this video was helpful for us to get to talk through peripheral parenteral nutrition, what some of the reasons are why you would use it, and kind of what it even means to be on PPN, why osmolarity is important, how to estimate osmolarity, and a practice calculation. If you have any questions or comments about this video or thoughts about a video you'd like to see in the future, please don't forget to leave those in the comments box below. Thanks for joining us for this video, and we will see you again next time.